Hello, I'm Bryan Ellertson. I'm a pediatrician here with Tanner Clinic at our East Layton location. And I do have a special interest in working with young people who have mental health or behavioral health struggles. Ones that I see quite often are things like autism spectrum disorder. Often we're seeing those kids a little younger, but sometimes you might see those kids a little older. So if your child's having a lot of difficulty understanding social interactions, well, struggling to make friends, struggling to listen to you or listen to teachers, and really struggling to understand those things, or maybe they're very rigid in their behaviors and they have a hard time with changes in schedule or changes in routine, or they're very restricted in what they eat, or their sleep is really struggling. It's a picture like that that goes together. Happy to visit about that and see if we need to do a referral, see if we need to do more evaluation. I'm also interested in working with kids that have attention deficit and hyperactivity disorder, ADHD. We're seeing a lot of that. We see it more and more each year. On the one hand, I really don't want to make a diagnosis if I don't think that it's really going to help a child, because I do worry that sometimes parents or teachers or people might want to give the diagnosis a little too quickly. And so I'm always very careful before we give a diagnosis and talk about therapies and talk about medications. Medications, of course, are always the last resort. But if you feel like your child is really struggling with their function, with school, with relationships, with learning, or if there's a lot of strong behavioral struggles at home, happy to visit, happy to talk through what your child is dealing with, and we can see if it makes sense to consider diagnosis or maybe look at other things. Another one we see a lot of lately is anxiety. We're seeing more and more year on year. This has been going on since even the 70s, but especially since COVID. We've been seeing more and more anxiety issues. And of course, everyone feels anxious sometimes, but you do get your child or adolescent where the anxiety just becomes debilitating. They're not able to make it to school. They're not able to do the things they want to. They can't make friends. Their function is decreasing. And there are options. There are therapies. There are medications if we need to. Again, always kind of the last resort with medicines. But happy to talk through what your child is going through. Happy to see if there's some way that either with a diagnosis or treatment options that if we can help your child live their best life, get to a point where they can do the things they want to do. Of course, mental health is always a very complicated question. Every child is an individual. But if you feel like your child is dealing with something that is really giving them a lot of grief, really making their life hard, then I do a half-hour visit for my new patients to talk more thoroughly about what they're dealing with. And of course, I'm interested in their perspective, but especially in a parent's perspective, to see if it makes sense to consider a diagnosis, to consider a treatment. And so please feel free to give us a call. Happy to schedule a visit. Depending on your insurance, we can do a visit in person. Sometimes we can even do it through a Zoom call, but happy to help any way I can.